Hey guys, it's the Psych NP. I hope everyone's doing really well. I just recently hit 500 subscribers. That means so much to me, guys. Thank you so much. I appreciate all the support. And if you haven't subscribed already, you can subscribe down below. So today I'll be doing a video on how to perform a medication management follow-up appointment in outpatient psychiatry. All right, guys, let's get to it. Hey guys, so the patient just comes in. So let's say, for example, I already saw this patient for an initial evaluation about 2 weeks ago. I prescribed a medication for them. Let's say that they had depression. I prescribed them Lexapro 10 milligrams. So I look at my first note that I saw and I kind of review it again just to get a backstory on them again and to remember, because you're going to have so many different patients. You want to remember exactly what happened to them, what stressors were they experiencing, and you want to find out what's been going on since you've seen them last. So I'll read my initial note. I'll ask them, how have you been doing these last 2 weeks? What's been going on? And I write 3 or 4 things from my last note. I ask them about it, whether it's about their job. In general, that's a pretty big stressor. Or I'll ask them about relationships, whether that still causing a lot of stress, or the relationships with their kids. How is that going? Whatever stressor that was really significant in their past, I'm going to ask them about it. Because that is probably one of the main reasons what's causing everything going on. Next thing, I look at their appearance. I want to see if anything changed. Are they more disheveled? Do they look at their affect? Are they more euthymic? Do they look more withdrawn? Are they tearful? How have they changed this session compared to last? You already know their baseline. That's why you review your last note on them, so you have an idea of what they were like before. I'll ask them, so, I know we started on Lexapro 10 milligrams. Any negative changes that you notice? Anything positive? Or did you notice anything at all? Did any family members notice any changes? A lot of times the family members are the people that will really see a difference. I know it's only been 2 weeks, and sometimes these medications take sometimes 4 to 6 weeks to take effect. So if there's no changes right now, who knows? We might as well stick on this medication dose. We could either add another medication later on in the future. We can increase the dose. We can stay as is until the 4 to 6 week mark. There's a lot of options you can go. It all matters on what kind of the patient, how are they presenting, how are they feeling. I'll ask about any side effects. That's the main thing. The main reason why people won't stay on medication is because of the side effects. If they're not experiencing any positive changes and they're having tons of negative side effects, well, why would they want to stay on the medication? Is it nausea or stomach upset on Lexapro, which is pretty common in that first week, that goes away over time? Or is it a sexual side effect? And then this is a lot more problematic. Is it impairing their quality of life? If that's the case, then most likely we're probably not going to be able to go up on the dose because those effects will be amplified. But you can even do changes. Whether you're taking Lexapro in the morning, you can dose it at nighttime, and hopefully that helps. You can, whether we add Wellbutrin or try Buspar. There's options to go, but it depends on how much is it really impairing their quality of life in comparison to how much it's really benefiting the patient. If this medication is making this patient feel so much better, and they say they can live with the sexual side effects, then you'll stick with the medication. There's newer medications like Trintellix or Vibrid, and they try to say they don't have sexual side effects. So, there's options, but you have to also let them know and tell them, these medications, no matter what, it's almost like flipping a coin or throwing a dart and hoping it sticks at the wall. These medications, they're all, 50-50 chance, and maybe it works with your brain chemistry, and then your body reacts well to it. They all affect, these affect serotonin, norepinephrine, but everyone responds differently. So you have to kind of warn them that if they're going to try to find a new medication, that it's a process, and we want to find the right medication right away, but a lot of times it doesn't work like that. The next thing I ask is their stressors. Can you tell me your top 3 stressors right now? And I list them, and I want to make sure if the stressors from the past got better or worse, or if these stressors now are contributing to whether it's their mood or anxiety or psychotic symptoms, things like that. Then I ask them about their support system. I just check on that, see if that's changed at all. And then I go down my list, my little screening tool. So I already have a baseline of how they responded last time. So can you rate your mood for me? 0 being really sad and depressed, 10 being as happy as you can be. What would you rate it these last 2 weeks? And I know what they scored the last time, but I don't tell them. And I review their answer this time, and I let them know, okay, it looks like you've improved a little bit. These are just numbers, and they're just scales, but they give you a baseline to kind of see maybe they're doing a little bit better, and maybe they don't notice. And it really helps kind of gauge how they're doing. You have these screening tools, the PHQ-9, the GAD-7, but to have your own tool as well is pretty helpful. And then I test their anxiety. 0 being none at all, 10 being you can't even function. How has that been these last 2 weeks? And then if they tell you about their anxiety, ask them about, okay, well, what's been causing these stressors, or what's been causing this anxiety, and how have you, responded to it, or do you have coping skills? How did you used to respond to these events, and have they changed at all with this medication? Then we talk about panic attacks. Have you had any panic attacks these last 2 weeks? Or irritability, 0 being none at all, 10 being going to rip everybody's head off. How has that been? Gauge their anger. Are they still feeling on edge all the time? Did that improve? Any little step that's improving always helps this patient, because sometimes they don't even know if it's really helping them. But if even these little minute kind of details, and you let them know, it really empowers them, especially if they really have some improvements and they just don't notice. Let's say their mood was a 4 out of 10, but then this time it's a 5. Well, that's an improvement. Any little improvement will take, and it will hopefully empower them and kind of boost their confidence as well. We'll talk about sleep. How many hours of sleep are you getting a night? Is it better? Are you able to initiate sleep faster? Are you getting more hours? Are you able to stay, sleeping throughout the whole night? What is your sleep hygiene like? Are you exercising throughout the day? Are you generally tired at night? Are you taking any naps during the day? Are you drinking caffeine? And what about mood swings? Do you ever have periods of feeling happy and then really sad without a trigger? Or you look at, do you ever just wake up in the morning feeling really down, and then maybe later you feel happy and no trigger at all? I try to look at those kind of things and see if there's any pattern. If it's a female, during her period, her cycle. There's just so many different factors that can contribute. So you have to really get all the information. And then we'll talk about energy. How would you rate your energy for me? Poor, very good. A lot of times when people aren't feeling the greatest, they're going to have very low energy. But as the medication kind of wears on, they're going to start feeling better. But also there's other factors, whether it's the medical concerns that maybe are not getting treated correctly. Maybe they're overweight, or they're obese, or maybe their job is really difficult and they just don't have they're just exhausted throughout the day. Maybe they're not sleeping well enough. And there's a lot of factors with energy. And then we'll talk about concentration. How can you concentrate? How is your concentration at work, at home? Are you able to focus? I have a lot of patients, especially adults, that want to ask about ADHD medications, and you ask about their childhood. How were your grades in elementary school and middle school? How was your focus? You look at the kind of the ADHD screening tools. A lot of people generally, though, if you're going to really have ADHD, it's going to be really apparent. As a kid, they're really going to struggle in school and those things. We'll talk about appetite. Poor, very good, and then obviously you have to kind of really examine that one. So are you eating more? Are you eating less? Have you lost weight? Are you eating really bad foods? Are you stress eating? These things. And then I still ask them, if you had to tell me 2 or 3 things that you enjoy, what would they be? You always want to follow up and see if they're still enjoying things, or maybe they picked up a new hobby. These are things just to talk to people. You're not just, they are your patient, but you also want to talk to them, ask them about their day, not be so rushed to focus on these symptoms, because that's what we do. We target symptoms. We try to solve problems, but really these medications just solve symptoms and help improve their quality of life if they work for them. You see patients that will come in over and over again that don't feel good. You could prescribe 10 medications and you see it on their face how disheartened they are. They don't even want to try. And even for yourself, you're like, am I missing something? Maybe they're medication management resistant. You want to give them some hope. They might have seen so many providers, and maybe they've already seen so many therapists. It can be difficult because, and maybe there'll be a time when you just feel like, hey, maybe this person needs another provider that has maybe more experience, that maybe is with the specialty, or maybe they just don't need medications at all. Maybe they need a follow-up with a primary care or an endocrinologist or a neurologist. There's just so many factors. There's TMS, ECT, ketamine. There's options. Then you ask them about, further down the assessment, you ask them about any thoughts of hurting yourself or hurting others, or hearing voices or seeing things. Any thoughts of guilt and worthlessness. You kind of want to go, get this question a little bit later on. You want to talk about kind of how they've been and assess kind of their symptoms. And then you ask them about any mania, obsessions, compulsions, phobias, those things, trauma, hair pulling, OCD-like symptoms. And then we'll go about tobacco use. Any tobacco use in the last 2 weeks. What about alcohol? Any caffeine? And then any illicit drug use. Did that ramp up? These are things, any little factor that we can kind of see in these last 2 weeks, because we really want to see the whole picture. Medications can do something, but let's say you put them on Lexapro 10 milligrams, but then maybe their dad died just last week. Well, Lexapro is not going to help that. They're going to feel really down. These stressors can be significant, or someone gets raped, or anything significant. Medication changes, they're not always warranted. Every time a patient comes in, you don't have to increase the medication or add something. If it's a stress, or if they have a lot of anxiety, maybe you want them to work on more CBT skills, or mindfulness, or grounding. Medications can help, but you have to be pretty smart when you prescribe them and when you want to. Like a patient like this with Lexapro 10 milligrams, it's only been 2 weeks, so most likely you want to wait it out a little bit longer. As long as there's no negative side effects and they don't feel worse on the medication, tell them to stick it out. Let's see how it goes in 3 or 4 weeks, and then we'll reassess. If there's maybe any improvements, we can go up on the dose. Or if they feel worse on this medication or dizzy, you can look into other medical factors. Are they drinking water? Get their blood pressure checked. But maybe they just need another medication. Everyone responds differently to every medication. I like to see patients every 2 weeks, especially when I do a medication change. Especially initially, you see them for the initial assessment, but then you want to see them for a follow-up appointment. You want to kind of see them, fairly regularly until they're stabilized on a medication. Then you can see them every couple of months, 1 month, 2 months. But then it's all about how they, what do they feel comfortable with? You can say, hey, I'll see you in 3 months, but if anything comes up, you can shoot me an email and I'll see you sooner. Or you have a question about a side effect, you can respond to them. Do I need any labs? Do I need to refer them out to a primary care or another specialist? Is there a medical concern that I think needs some attention? Do they have a therapist in place? Like I said, we are specialized in therapy in school. We're not at the level of a psychologist or an LCSW or a licensed clinical counselor that maybe has a lot more experience with therapy. But I do think learning CBT is pretty important, whether you can find a class online or just to strengthen some of your skills. Because therapy, I use interpersonal and supportive therapy on every appointment, because I think these are such really powerful techniques that we can add on to our appointments that can help our patients. And if I think there's a therapist in my head that I could refer them to, whether it's a specialist in EMDR for trauma, or if it's just a depression anxiety case, and I think there's a really good CBT therapist that I could refer them to. In your head, you're always thinking of how they're responding to each question, how you're going to adjust the medication if need be. If you even need to adjust the medication at all, when do you want to see them? In your head, you're already thinking of a backup plan. So what am I going to do next? What am I going to do next? If this happens, what am I going to do next? I already have 3 plans, no matter how they come in. I'm expecting the worst, which I don't want, just so I have a plan. You never want to go into an appointment and not be prepared, and something happens and you just don't know what to do. And if that's the case, then you pause. You consult with maybe a different provider or try to get their input, but you don't just prescribe something just for the hell of it, because you don't know what to do. You just have to be prepared. That's the critical thinking is everything. And that's really how it goes, guys. Outpatient assessments, follow-up appointments. It's nice because now you're building this relationship with the patient. You already saw them for the initial assessment, and now you get to see them for a follow-up and hopefully continuing their care. And it feels really good when you can find a patient when you've seen them at kind of their lowest. Maybe not their lowest, this is outpatient, but when they weren't doing so great, and you've really gotten to a place where they're feeling better and hopeful for the future. And this continues, and it's a really great feeling. All right, guys, it's the Psych and P out.